I'm Dr. Travis Henry. I work at Midwest Veterinary Dental Services. I've been a veterinarian for 31 years, and my primary focus has been dentistry for the later half of my practice career, and I'm a board-certified dentist both in small animal and equine practice. Being a dental practitioner, what we need to do on a daily basis to make a diagnosis requires sedation. I cannot effectively take a diagnostic set of films on a horse's head without them being well sedated. I can't stick a mirror in their mouth or small sharp instruments and make diagnosis of the pocket depths or pick food between their teeth without sedation. So people that, say to me, why do you have to sedate my horse when somebody else doesn't? My usual to the client specifically and to, the staff that's helping me and trying to keep them safe is that the idea is that I want to make this a very efficient process, and I want to not take an hour to complete an oral exam by fighting with the horse to the point where somebody gets injured. I tell the clients that the risk of doing this in an unsedated patient and trying to fight with the horse is a much higher risk with many more complications than it is with sedatives. And realistically, if we talk to a lot of anesthesiologists, and some of those are good friends of mine, the actual occurrence of complications related to actual sedation product is very, very low. Fortunately, I've been using Sedation for 31 years, which is my entire practice career. Was introduced to it in my first job. Found out what I considered it to be safe, predictable, and from there on, I've used it as the main sedatory drug for most of my patients. First, let's just start with the science. If you look at using dermospan versus xylazine, because a lot of people talk, well, I'll mix some xylazine in with my dermospan, that saves me some money. I would argue that you're actually watering down your dermospan, because when we look at the receptor score and the science of that drug compared to xylazine and other drugs that are out there, we have the highest affinity for the receptor. So I want to put the best drug in that patient to get the sedative effect that I want. And why would I be watering that down? And so for me, the people that are selling us this product are also supporting us. And that support to me goes a long way. I would rather use a product in my practice that I know they've got my back than the product that I try to call the phone number and I don't get anybody when I've got a problem.